All right. Well, welcome everyone. Thank you so much for attending today. Today we are excited to welcome our November Behavioral Health Advisory Group meeting. And we have a few speakers with us today. So we're going to have a wonderful meeting as always. So to get us started today, we'll do some introductions and a brief welcome, and then we'll jump into our panel discussion of spotlighting the Dyer Care Center and Shepherd Pratt's Youth First Care Program. We'll open it up to some Q&A from all of our BHAG members, and then we will move into a review of the BHAG Partner Survey. We'll discuss our plans for meetings for the rest of the year. If you would believe it, it's already that time as we look to the end of the year, and then opening up 2024 with some meetings. And then we will go over our community announcements and we will adjourn for the day. All right, so before we jump into our panel discussion, I just wanted to open the floor to any new members that we have today, or if anyone would like to introduce themselves to the group. All right,
Okay,
we'll just, oh, go ahead.
jump in. I'm Anthony Galladay. I'm with RI International. I'm also the program director for the Dyer Care Center.
Welcome. Thank you so much for joining us, Anthony.
Thank you.
And folks, just continue to use that chat function. And before we kick into some things, we also wanted to take a quick mindful minute. We realize that on this call, we are dealing with a lot of behavioral health specialists. We know that as the holidays approach and the end of the year, schedules are very, very busy, and we are often stretched a little thin. So we just wanted to take a quick moment, if everyone wouldn't mind, just disconnecting for a quick minute and just taking a minute to be mindful and think of 3 things that you're thankful for. You don't have to share, so we'll just take a brief 1-minute pause and then we will resume. All right, well, hopefully that allowed everyone just a quick minute to just think about some things and just check in with yourself, and just remember during all of the busyness with the end of the year, just remember to check in, take a minute, and you can only pour from a full glass. So thank you all for that. So without further ado, I'm going to go ahead and introduce our panelists for today. So today we are joined by Anthony Galladay, who is the director of the Dyer Care Crisis Center, and Vicki Lopez, who is the acting associate program director and clinical supervisor, and also serves as the co-director of Shepherd Pratt's Youth First Care Program. So welcome, Anthony, and welcome, Vicki. Thank you so much for joining us today. We are very, very fortunate to have you both. So I just gave a very abbreviated version of your bios, but if you would each like to present on your organization or program and give a little bit more of an introduction, that would be wonderful. Anthony, do you mind if we start with you today?
Sure, I'll go first. Usually it's ladies first, but I'll take it. Okay, so good afternoon, everyone. I'm Anthony Galladay with the Dyer Care Center. I'm a social worker by training. Attended Howard University in Washington, D.C. I've been in the field for 25 plus years. I'm excited to be with RI International since June. We're looking forward to opening the Diet Care Center in the very near future. I'll just go into it a little bit. It is a 16 chair crisis receiving and stabilization center. We're so excited to be bringing this service to Prince George's County. We'll provide 23-hour observational and stabilization care. We adhere to the crisis now model, no wrong door. Anybody can walk in. Police and EMS will be escorting people at a separate door. As I said, we're available 24 hours a day, 7 days a week. We connect with individuals following any behavioral health emergency, to the best possible outcomes and follow-up stabilization. We're working closely with the community in partnership, and we provide state-of-the-art best practice services. So, any questions about Diet Care Center? How deep do you want me to go?
Do any of our audience members have any questions? I guess just a broad question for you, Anthony.
Sure.
So on the call, we have stakeholders from numerous fields, numerous backgrounds, all different agencies here. As a BHAG, how can we support the Dire Care Center? I know doors haven't opened yet, but are there any ways for promotion, for those referrals, anything that we can do to assist y'all?
Absolutely. So it's a partnership. We are there to provide crisis intervention, but we also need to work with community providers for ongoing care. So we don't solve all problems, but we handle emergencies and kind of stabilize usually, your clients coming from other agencies. And once they're stabilized from the crisis at the Diet Care Center, we return them to appropriate community resources. So it's a partnership.
Can I follow up on that question, Taylor? Anthony, I'm wondering, so for the partners that you'll be working with, will there be formal MOUs or agreements in place? What will that look like if a partner wants to work with Dire Care Center as a referral partner?
Well, we don't turn anybody down. So if you have a client who's in your program and they come out because of an emergency, we're hopeful that you'll be able to receive them back once they're stabilized. That's an area we hadn't got into a lot about memos of understanding, but in the treatment community, best practice is to continue care. Have a ongoing treatment plan and care with a provider.
I guess I'm thinking if someone comes in and they haven't been previously connected to care, or it was a long time ago, they don't remember, whatever it may be, how do you determine which provider you would refer that client to? Or what do you envision that process looking like?
Sure. I envision it looking like clinicians and social workers doing the research and trying to connect people with the best provider. So, that's something we wouldn't know off the top of our heads, but we would figure it out within that 24 hours and make the appropriate referrals and connect, with hopefully more than one provider and pick the best one, the best fit.
Okay, that's just a question I get a lot from providers when I interact in various settings, is how do I become a referral partner of X, Y, and Z entity? So I appreciate that.
So maybe if I could just jump in a little bit. I think we sort of talked about this before one of the sessions before Anthony joined, but we are working on getting a referral system that would be part of the local behavioral health. It's behavioral health link. We have it right now in our MRT module. We're looking at buying a referral module, and we sort of talked about it being, that way people can, referrals will be sent out to people that want to be engaged and getting this coordination of care. So there will have to be these MOUs and things and systems and processes developed. But at this point, we were trying to decide what kind of platform we're going to use. We can bring it back to this group, or as, Anthony comes on board, we're hoping that those that want to be really engaged and become a provider, that Anthony could be talking to them one-on-one, really networking and bringing, how do you want to get a referral? Can you get a referral this way? The referral platform that we are looking at, it has sort of two functionalities. Just real briefly, one that could be like, we'll put a referral out there, and we're going to call them our community partners. They can see that Margaret needs to see a therapist tomorrow, right? And then there can be, people can go in that's in the network, grab that, and hopefully have some explanations about, like Anthony said, if it's, I want a female practitioner versus a male practitioner, that those referrals would be, put out there, and it would be notes on what they prefer, where they're coming from, some of their triggers. So then the providers can go out and select them to say, yes, this will be a good fit for me as well. So then there's also another one where actually if the provider wanted to show that they have an appointment available, that they could even go in and make the appointment. We have not decided on which platform would be better for the Dire Care Center at this point. But those are some of the fine details that we're working out as we're getting closer to opening. And, I think Denise had I think one of the things we're working on too is having that coordination of care document, and what does that look like, and how do we need to transition whatever that is. And hopefully this group can help develop that. And this is why we wanted Anthony to come to this group, because, some can receive electronically, some need it the old fashioned way, but then what do you need for this patient to be transferred to you? So I think some of those things, and that's where we're hoping with Anthony can meet with, some of these immediate providers that say, hey, yes, I want to be in, I want to be a first, we can get that started. And then, especially getting some of the foundation of coordination paperwork, let's say, and building that referral network. So that's to be developed, and we're working with Anthony on getting that done.
Thanks, Margaret.
Oh, you're welcome. We're a team.
Yes.
This is JB Moore. What's the projected opening date for the Dyer Center?
Well, construction is still ongoing. We're hoping sometime after Christmas, sometime after Christmas.
Okay, thank you.
Sure.
I think just to add a little bit more, I think the one thing I just want the group to know is, we're still waiting for the state to really adopt final regulations for the full crisis stabilization center to operate the way it is, the crisis now model. So that is always a little bit tricky, right? So plan B, we're proactively opening, going after a license that we know exists, but we're hoping that those, it's all going to be about when the state gets those licensures up and running. So we're going to be ready, is what we're going to be ready by December. But unfortunately, we have to depend upon state regulations and licensures. So just wanted to make sure, we don't want to mislead anybody. This is our goal. We're going to be ready December, the end of December, but that will be one thing that will be slightly out of our control.
And are there any resources to stay up to date about the information of the opening, or any channels folks can subscribe to be updated with this information?
Actually, what we're doing with TLC right now, we're supporting the Dire Care Center. We're developing that web page, but we can't really put it up until, like the phone number and all that. So TLC is posting like pictures that are and progress of the Dire Care Center. So, that's what we're doing right now, letting everybody see like how close we're getting, what's coming up. But, I would say, Anthony, I'm going to put you out there. Please reach out directly to Anthony if you have questions, if you need additional information, wanting to get involved as far as a referral for the Dire Care Center. This is why we wanted to invite Anthony to come so you could see who he is and just really, it's that, even though it's virtual, it's, a face to a name. Just directly meet with him because, each of you may have slightly different things that you're going to need to be involved with the Dire Care Center. Each of you may have a different way you want to get involved with the Dire Care Center. Our hope is, one of the big things is if we need staff. We're looking for staffing positions. There's going to be probably about, let's see, we have 4, 8, 12 positions, about 15 new positions that are going to need to be filled. If you want to be part of it, part-time, PRN, we want it to be a whole community team. So Anthony's going to need a lot of support, a lot of staffing. So please just reach out to him with the questions and get to know him.
I'll put my email in the chat.
Thank you so much for that. Any other questions? Folks can either unmute or put them in the chat. All right. Well, thank you so much, Anthony, for speaking with us today. This has been very informative and, again, just good to put a face to the name, and really appreciate you offering your time today.
Thank you. Thank you for having me.
Absolutely. And Vicky, whenever you are ready.
Yeah, perfect. Thank you. We'll definitely be reaching out, Anthony, because as school-based, we unfortunately use crisis services quite a lot. But my name is Vicky Lopez. Hello to everyone. This is the first time actively participating in the meeting. So you may not have seen my face. I am the Associate Director for Shepherd Pratt's Youth First Care Program. I do have a PowerPoint. I think I can present, correct, Taylor? Okay, so just, I'm a visual person, so I always try to make visuals for others. And hopefully I can make this work. Oops. Forgot I'm supposed to do slideshow. Okay. There we go. And you guys can see that PowerPoint?
Yes, we can.
Okay, thank you. So again, I'm part of Shepherd Pratt's Youth First Care Program. Shepherd Pratt, you might have already heard, it's a hospital system in the state of Maryland, but we're part of the Community and Schools Division. So we focus more on community and school-based programming. So that's where kind of like my area focus is, and especially in the Youth First Care Program with Prince George's County Public Schools. This was actually it started about 5 years ago as this idea for Prince George's County that they wanted one therapist in each of their schools. And actually, this is the 5th year of the programming, and they actually all of the schools have been assigned a therapist. We're still in the process of hiring a therapist for each school. So each school in Prince George's County has a full-time therapist available, or should have one this school year. So we are just one of, I believe, 7 agencies that support Prince George's County in this initiative. We have, and I'll go a little bit into that as the presentation goes, but just a little bit about the directors, and I did include emails in there. We have Liz Briganti. She is our program director. She actually could not make it today, but her contact information is there, as well as mine as the associate program director, also clinical supervisor. My information is there. Just a little bio about myself. I've been in school-based services for more than 8 years now, providing mental health services, as well as working as ESOL counselor at one point in Montgomery County as a helping and supporting newly arrived and newly enrolled students and families. And now I have the benefit, I'm here supporting this program that has been up and growing in an area that has a lot of mental health needs. So definitely we are proud to be serving the Prince George's County schools. So again, we provide a compassionate services with our mental health therapists. We work collaboratively with Prince George's County Schools, so we are actually contracted by Prince George's County Schools to provide school-based services. Our therapists are fully integrated into the schools. What do I mean by that? Like every day, our therapists are reporting 5 days a week to the schools. They are assigned confidential spaces, office space to actually meet and have mental health services provided to the students in individual, group, etc. Part of that too, the benefit is that, the way we think about it, it's almost like a private practice, kind of like dropped into the middle of the school. So we're in there, we're a separate entity, but at the same time, we work collaboratively with the schools. Our services are available to all students and families at no cost. We do not bill insurances, which we will talk a little bit about more later. But the only thing is that, just a reminder, our services are open to all the students of PGCPS. I did include here Prince George's County Mental Health page, where they have our resources, Youth First Care, as well as other mental health resources for students of PGCPS, just so that you guys have access to that information as well. This is the list of schools that Sheppard Pratt serves. We have a total of 34 schools between elementary school, middle, and high school. These are schools where Sheppard Pratt actually has full-time therapists working at. So as you see, we have a couple of elementary schools, a couple of middle schools. We have some of the special programs like international high schools and the non-traditional program, middle school. So if for some reason you know of any student, or you know of a staff member that knows of a student in any of these schools, definitely Liz or myself can be your first point of contact so that we can refer you to the proper therapist and get that referral going for mental health services. And I'll definitely email this so the PowerPoint can be emailed out with the list of the full list of schools. So our team it's very diverse. We consist of clinical social workers like myself, mental health counselors, as well as a couple art therapists we have in our team. Our therapists are trained and some are certified in trauma-focused CBT, play therapy, sand tray therapy, some of the trauma interventions such as EMDR and somatic experiencing. We have a team of 6 board-approved supervisors who are also there to support our staff who are still working under someone's license. Some of the things that our therapists do, and this is not an extensive list because they do a million things every day at the school, but just to kind of categorize everything, we provide child, family, and group therapy. Family therapy is definitely more focused on working with the child, not necessarily any of the other issues going on in the family. Diagnostic evaluations and treatment planning, which is part of the therapy process. We help with skill development, also student support groups. We also support the school with any crisis intervention and stabilization. So since we are not PGCPS staff, there's certain things we're limited to doing, but at least supporting in school-wide crisis. Sometimes we've had death in the school, whether it be another student, whether it be a staff member. Our team is definitely the first ones to be on site supporting the students. We also provide classroom observations to help teachers and consult teachers with different methods and interventions they can use in the classroom to better support the students. We also provide parent and staff workshops on behavioral issues and a variety of issues that come up. And we also provide referrals and supports for psychiatric care and medication management. Actually, an initiative we began last year was connecting with our own Shepherd Pratt's outpatient mental health clinic. It's actually based in Montgomery County. It's in Gaithersburg, but what we were able to provide is free services for psychiatric and medication management for our therapy clients. We provided telehealth services with a psychiatrist at our Gaithersburg clinic, and were able to provide medication management for those clients. So that's again another benefit of being a part of our program. But even if we can't connect them with our own, we also have networked with a couple of other agencies within the Prince George's community just to be able to refer for psychiatric care as well. So briefly, who's eligible for the mental health services? First of all, they have to be a PGCPS students. They have to be enrolled in one of our PGCPS schools. Again, like I mentioned, there are other agencies that work with other schools. So if there's like a transfer to another school that is not part of Shepherd Pratt, we still collaborate with that agency in connecting them to services so there isn't that gap in services. Services are voluntary, so definitely the parents, or if they're self-consenting youth, they have to agree to the services. So even if the school or the staff really believe the services are needed, the parents have to be on board. Definitely for students experiencing barriers to accessing mental health care elsewhere, whether they're uninsured, underinsured, whether they have the barrier of transportation, of time, that is something that, we definitely want to prioritize those students so that they can have access to the services. And also the needs of the child cannot exceed what can be provided in an outpatient clinic type of setting. So definitely if the needs are more intense, we work on referring them out, sometimes to our own Shepherd Pratt hospitals or treatment centers in order for them to receive the support that they need. So just here, some examples, we definitely, it's not necessarily just trauma work. It's sometimes working with children who have difficulty managing emotions or even behaviors at school or at home. And here are some examples of some of the children that we work with. And those are, again, it's not an all-inclusive list, but just to give you some ideas of some of the things that we work on, whether it be in the individual level or in a group setting. And here are a couple more as well. So referral process, how does that work? There is a system. We work collaboratively with the school. Usually a referral happens if a school staff or even a student themselves or a parent wants to make a referral. They start out by contacting their counselor or CSC, which are community school coordinators, which some of our schools have, not all of them. So you would contact either or. And then they will review the referral and then make a formal referral to our mental health therapist. Within 24 hours of receiving the referral from the CSE or the counselor, the therapist does reach out, assess needs. There have been situations where we have reached out to the children and there are concerns, there are crises that come up. So we actually support in referring out to crisis services. So, we really make sure that we make contact as soon as possible with the families. After that, therapist will determine if, services can be provided. And if services can't be provided, again, we work on connecting them. We don't just say, sorry, we can't serve you. We actually work continuously with them until we find them something that can support their needs. And that's the presentation. Any questions?
Vicki, I just have a real quick question. Sorry, I've been burning to ask this. So thank you for that presentation. Just a quick question regarding, I know our MRT has been called to the school at times for children that are both in elementary and middle. I think there's been a couple at middle. Do you, and I'm wondering if there's a connection, had there been referrals from our MRT teams to you guys at the school, or how would they make it at those individual schools?
So we haven't heard of any, but it could be the case where maybe they reached out to the school connected them to the therapist, so it happened more at the individual school level.
Okay.
But if you ever find the need, especially if the school is in our list, you can always reach out to us and we can help you with that connection, make that connection.
I just want to make sure I get your information to our MRT team, because, having the school-based counselor right there is really, really helpful. So, again, as we're building this, system of care, that we basically can navigate them to the closest and easiest source of help. So I just was wondering if that had been, so I'm going to make sure that our MRT chief operating officer gets this information. So thank you.
Perfect. Yeah. And I think Taylor added our emails to the chat.
Is anyone on from our MRT team? Do we know? Maybe they don't have to do it if they're on.
Any other questions? You guys were easy. Here, I thought I was going to get bombarded with questions.
I'll ask you the same question that we asked Anthony. As a BHAG, how can we support you?
That's a good point. I think just our program hasn't been well known, even though we've been around for 5 years. I think because we're working solely in the schools, we're not like out in the community, but we also we would benefit of networking. We're always trying to network with other agencies, for example, crisis services, psychiatric, because sometimes even our own OMHC is full and cannot accept more medication management or those that need psychiatric care. So we're always looking for that type of referrals, bilingual, especially bilingual services in that sense as well. That is a high need in our schools. So definitely, it's making those networks and connections in different areas in PG, because I don't know if you notice, our schools go from like Oxon Hill all the way up to Langley Park. So, we cover a wide range in PG. So not only resources in one area, but especially now that, the needs are really much necessary, we want to have these networks everywhere.
So Vicki, I have one other question.
Sorry.
And this is more of like a process, because I know when I worked with the school system, I used to be I work at a hospital, and we worked with children that were EP'd from school to the hospital. And then at times what would happen would be, they would be EP'd and we didn't know who knew at the school level. And then sometimes the parents would come and get them and they wouldn't be seen and they would be back in school the next day. And the school's like, well, what happened?
Mhm.
Is there any connection or is there any process by which, if something like that were to happen, are there avenues by which the school therapist would at least be known, or the nurse or somebody, what has happened to that child? Because what we found is, sometimes it would be, and I worked on the school wellness council. And so it was like, how do we connect that dot, right, between the hospital, behavioral health, and finding out like what truly happened to that child who had that crisis situation that they had to be removed from school. And then making sure again that they're getting, if there's the counselors that are right there at the school, just wondering if anything like that been to try to be developed within Prince George's County.
So definitely, since we do have an MOU, or we do have an agreement with Prince George's County Schools, we are under, of course, HIPAA. So there are releases of information so that we can communicate with the schools. We also fall under FERPA. So that also allows for some sort of communication regarding what's going on. And the benefits of our therapists being there 5 days a week is that they do build these relationships with the school staff. So it comes to the point where they're communicating like, this is happening, I've had to refer them to a hospital. If they do communicate with the hospital, they're kind of the middle person to communicating to the school what's going on. So I think that has been another benefit of this program, that again, even though we're Shepherd Pratt, we're also very much a part of the school themselves, and we're able to connect different, for example, hospital, and pass on some information that might be useful for the school.
Okay, thank you.
And Vicky, one more question for you here. An important stakeholder in all of this are the parents. And so I was just curious with how much stigma mental health carries, and sometimes that's more generational. What is it like getting buy-in from the parents? Has that been a challenge for you all? Is that something that you're having to do more training with, or how is that going for you?
All of the above. So there is a stigma, and Prince George's County, it is a predominantly Black and Brown community. So there is a lot of education. I think relationship building has been one of our strengths. For example, the reason we actually have referrals go through a counselor or a CSC is because these are individuals that already have built a relationship with the families. So, for example, if your child is being referred for therapy, it's much easier in the ears to hear it from a school member versus just having a random therapist call you and say like, hey, your child was referred for services. So again, that relationship building has really helped. We do a lot of, like, for open houses at the beginning of the school year, our therapists are present, almost doing like meet and greets, small presentations about our program. We do parent workshops as well, as we mentioned. So we're doing workshops about just basic things, how to handle tantrums, sometimes bigger, how to talk about drug use, or, a lot of the stuff that's going on with our teens. So I think, again, that relationship building has really helped. But, there is still the challenge. You still have those few outliers that, they still don't agree too much with mental health, or have resistance to it. But most of our therapists have been able to hold like conversations with the parents and just letting them know what the process is, how it looks. And very rarely do we have those cases where they just don't want services. And for the most part, those cases, they have outside services sometimes.
Vicki, this is JB with NAMI, Prince George's County. We offer a lot of services for the family members in terms of education, when we do actually quite well with families. So please feel free to refer any family member needing some education around that mental health issue to us. Thank you.
Perfect. Thank you.
Any other questions or any comments for Vicky?
Hi, this is Gina Greenhood from the local Behavioral Health Authority here at the Health Department. I did just want to mention that the Health Department has two new grants. One is a System of Care grant that will serve children birth to 21, and the second one is a Healthy Transitions grant that will work with youth 16 to 24. They're really new, so we're still in the process of developing like referrals and how that's going to work and all that kind of stuff. But it may be a resource for your therapists to be able to refer youth and families that require some additional supports outside of school. For the children, there may be some, possibility of in-home services, peer support, that kind of thing. For the transitional age youth, they could actually have access to a transition coordinator who could help coordinate the needs of that youth, whether it be a specialized therapy or whatever. But they would also have access to trauma-informed care. So just putting that out there.
Thank you. And please send any information. I feel like sometimes as school-based therapists, they are the first stop. And sometimes knowing the families, knowing all of the issues and problems going on. So we also, I mean, it's not official, but we do a lot of case management as well and referring out, providing resources. So any resource available are definitely more than welcome. Please email and we will definitely share.
Perfect. We'll keep it in mind as we're coming up with the referral pathways.
Thank you.
Thank you for that, Gina, for sharing that information. And also,
I was waiting on you to say it, Denise, but you didn't pipe up.
We've shared it before at previous meeting, and we've also plan to share it in the end at the community updates. Also, Vicky, thank you for that overview. One of the experience that we've had working with schools is that for outside entity or service provider, there seems to be this culture in the school where providers want to come in, has to have a formal contract or an MOU or some kind of official documentation memorializing the partnership with the school. And oftentimes that is not the easiest feat, right? We've done that with our suicide prevention program, and which is a part of the SOC grant actually. And it took like a year. And by the time we had it in place, it was only 3 months left to really execute the MOU. And then trying to renew it takes a long time. So it sounds like that formal contractual process. Maybe you could just talk a little bit about, how did you all get in with the school to do that? We've since overcome that. So the BHS, Behavioral Health Services Division at the Health Department, have since established an MOU with the Prince George's County School District. So our service providers that we're working with moving forward and our programs will be able to partner with the school without any issues moving forward. And actually, I think we have like a 3-year MOU that has options. So it will make things less cumbersome to get the students the timely services they need.
So a lot of the beginnings of the inception of the program was beyond my time before I came on board. But I do know it began as a smaller program called TNI, Transforming Neighborhood Initiatives. Some of you might recall, where we were just going into the schools, providing therapy and coming out. Like we weren't really incorporated into the schools. My understanding is that this came from Prince George's County Schools, where they came out with an RFP service. So they requested the services themselves. And that's when a couple of agencies began to apply. It started with a few schools to the point where we are now, where technically all the schools have a full-time therapist. Definitely it continues to grow. Our Prince George is looking to expand, for example, looking for substance abuse counselors specifically for some of our high schools. Also, even reaching out and thinking of like possibly 2 therapists in some of our bigger schools, just because one therapist is not enough. It definitely is not enough, not even for elementary schools, but, definitely, I know they do, they offer their RFP. I think the RFP is probably either going to do it in a next year or a couple in 2 years, I forget. And so there is a lot of opportunity, to be a part of that and incorporating yourselves in it, because the program, it just continues growing.
Thank you. Yeah, and they're putting more money, I think at the county level, at the state level, tons and tons of dollars are coming into the school, which rightfully so. It's been neglected for so long that it's long overdue. I'm just worried about, the high dosage of services and people tripping over each other with all these services, and it's not coordinated. The good thing is that the health department, once the hub RFP is out, the local behavioral health authority or other entities have the opportunity to be able to bring some cohesiveness towards that and some coordination, so things are coordinated, because it's a lot of resources in the county, right?
Yeah.
It's just that the right hand often don't know what the left hand is doing, and things are not coordinated, and it's not in one central place. And this is what we aim to do, with these kind of work groups. So I'm gonna shut up now.
Yeah, we definitely agree, and that's why networking is so important for us. Work smart, not hard, right? So definitely, if somebody else is already providing that service, we don't have to reinvent the wheel. Let's just work with them. There's more than enough kids and just people that need help. So definitely networking. That's why any resources we definitely always welcome. And we've met with a couple of agencies, like one-on-one, just to see like how can we work on collaborating with each other. So again, since we tend to be kind of like that first point of contact for the families, definitely if you have any resources, reach out to us, and we can, and if interested, we can meet and further discuss how to continue collaborating together.
I think I'm going to throw out a wish list that we need a healthcare concierge for Prince George's County.
Plus 1,000 to that point, Margaret. Plus 1,000. Any other questions for Vicki, or any lingering questions for Anthony? All right. Well, we have contact information in the chat here. I'll be sure to send out Vicki's slides. Anthony, if there's any information you'd like for me to include in the notes, feel free to send that over as well. But with that, thank you, Anthony. Thank you, Vicki. Thank you so much for your time. What we aim to do here as a work group is try to increase awareness and try to connect folks so work is not being done in silos. And it's been another successful meeting of doing so. So thank you both so much for your time today.
Thank you.
Yes, thank you.
Yes.
You're welcome.
Round of applause. All righty. And in our remaining minutes, I am just going to jump over to share some slides. A few weeks ago, we had you all complete a partner survey to give a little bit more information about your organization and the services you provide. And so we just wanted to share the results of that to increase awareness of who we have at the table and to see who we may be missing, and to continue building off of these meetings that we are having. So let me go ahead and share this. So in that survey that we took of our BHAG members, we found that the work group has a nice array of folks in all different fields providing different services. So as you can see, there's a large mix from clinical care services all the way down to preventative services and peer recovery support services. We also had plenty of other services that were also named from the survey. So you can see everything from administrative oversight to emergency preparedness, reentry, resource linkages from our last meeting, recreational services, including childcare and summer camp programs. So we are reaching folks with all different services within this work group. So just wanted to put this out there so folks are aware that we have a very diverse group coming to the table each meeting, and we are just very thankful to have all of you here and to have so many different groups represented to be able to provide services to the county. Any questions or any reactions to the results of this question? And with that, we also had an excellent mix of populations served by the BHAG. So you can see we have a nice mix of organizations providing services to adolescents and adults, incarcerated individuals, experiencing homelessness, and then in our other category, some populations not named, we had counselors in training, veterans, children in that 6 to 12 age range, individuals experiencing substance use disorder. So again, we have a really nice array of organizations who serve various populations and are able to provide comprehensive services to the county. Any questions or any reactions to this slide? And I will also be sure to send out these slides so you can take a closer look at these. All right, and so this is all to say, we are currently using that BHAG partner survey to inform our upcoming meetings. So if everyone is enjoying this panel-like discussion, we hope to move forward with this type of meeting where we're able to spotlight some organizations, some programs, and services that are being provided to the community to hopefully be able to provide a networking opportunity and also provide some problem-solving spaces for us all to come together and to hear about challenges and successes going on in the county. So with that being said, here is our tentative plan for completing to the end of the year and then opening up 2024. So we were talking through involving some hospital partners for our December BHAG meeting in January, talking to those OMHCs that Vicki actually mentioned, and then in February, having some peer recovery specialists to discuss those peer support programs. This is all to say, please do reach out if any member on the BHAG would like to present on your organization or around a specific topic, and we can certainly get you on our calendar. But before we do that, did anyone want to volunteer their name or their organization to present in any of these upcoming panel discussions and or suggest any future panel discussions?
Hello, can you all hear me?
Yes, we can.
So yes, my name is Shatia Blunt. I have not been on a meeting in quite some time, so it's nice to see you all again. I am the owner of a what is now a private practice, but morphing into more of a mental health organization by the name of I Am Me LLC. And I'm currently working on a policy initiative with Senator Malcolm Augustine around getting public and private insurance providers to pay for an annual behavioral health visit, similarly to how they pay for somatic care without the need for a diagnosis. For those of us who work in behavioral health, we know that, that adjustment disorder sometimes is like a catch-all so that we can get reimbursed, which is, brings up some questions around ethics, et cetera. And so I'm really working very closely with the senator in this upcoming session, to get the legislation passed, and wanted to know if that is something that I could come to the BHAG group to present on to counter support, or if there's any individual BHAG members who will be interested in learning more about the policy initiative and possibly writing a testimony for that. So kind of a two-part. I would love to be able to present to this group if it's something that is fitting, or if not, I would love to be able to speak with individual people around the initiative. So that's my 2 cents, or my question.
Shatia, thank you for raising that question. This is Denise Dunbar. I'm a public health program chief at the health department.
Hi.
And we have been working with the Center for Law and Social Policy class, and we've been working with them for maybe 2 to 3 years now. And we just got word from them that actually in Colorado, there is I think somewhere in California and in Colorado, there is legislation. Yeah,
They-
there is a bill where young people can get services without any diagnosis. This has been done in the United States, and we're trying to replicate it here in Maryland. So
So
class,
they
they're working with Inseparable. I think it's a company called Inseparable to
Mhm.
put it out on a bill, and we actually have a draft. So I could talk to you offline about more and connect you with those folks.
Awesome. Awesome. And they have it, Colorado was the first, HB 21, House Bill 21. So they passed
Yes.
the bill last year. Since then, it's been Delaware, then Illinois, and also I want to say Massachusetts. So we presented it last year. It died on the Senate floor, but we're trying again this year. So yes, I'd love to. I can put my email in the chat, and we can connect in that way if possible.
Yep. And I'll connect you with the class folks, and they can connect you with you and the senator with Inseparable, who is taking lead on putting the bill on, proposing the bill.
Thank you.
Yeah. This is also NAMI, JB Moore at NAMI. We're also interested in providing testimony. So you can reach out to me. I put my information in the chat. Thank you.
Okay, thank you. I'm gonna just screenshot it because it's easier to do it here. Thank you so much.
Wonderful. Thank you so much. Yes. And my email address is here on the screen, and I'll also put it in the chat, and we can discuss scheduling coming up as well.
Awesome. And I know that I don't necessarily fit one of the categories, but if I can go in December and January, if possible, it would be ideal since typically the hearings are in the beginning of the year.
Absolutely.
Thank you.
Yes. Thank you. All right. See, that problem solving right in action. And I didn't pay for that. That wasn't a paid actress, that was all happening. All right. Any other individuals or any other organizations interested in presenting in upcoming meetings? And if you don't feel comfortable saying now, feel free to email me and we can get you on the calendar.
Hi, Taylor. This is Tara Davis-Ramah from Nemo Mental Health. I did put in the chat, but I'm also interested in presenting in one of the upcoming meetings on the services that we provide.
Wonderful. Thank you, Tara.
Thank you. Thank you so much.
All right, folks. Let me go ahead and move to our next slide. But again, just email me if you are interested. We're just going to move into our community announcements. So just two things we wanted to bring attention to. So for those who were unable to attend the Board of Health Mental Health Town Hall last week, we have included the link to view this town hall meeting. There was a wonderful presentation and some community testimony. So if you would like to view that, I will put the link in the chat. And also, just so everyone is aware to put this on folks' calendars, the Prince George's County Healthcare Action Coalition, we are having our next in-person quarterly meeting. It'll be on Tuesday, December 12th from 6 to 7:30 p.m. at the Kentland Community Center. Again, this will be an in-person meeting and we will be having a wonderful meal. So if you are able, please scan this. You can scan this QR code, and I'll also put the link in the chat to be able to register, and you'll be able to pick from one of 3 food options, I do believe, for that meeting. So just go ahead and register if you're able to make it. We hope to see everyone in person. We will just be doing a year recap, and we also will have some speakers from 211, 311, and 988 to share information about connecting with those resources. So will be a very great informative session there. Before we move on, are there any other community announcements anyone would like to share? All right. And just echoing Carlos's point, wonderful presentations as always. Alrighty, well, thank you all for attending. Thank you for your questions and for your interest today. Our next meeting will be Wednesday, December 20th from 3 to 4:15 p.m. But certainly do be on the lookout. I'll send out these slides as well as Vicky's slides over. And if you have any community announcements between now and then, feel free to also submit those. Otherwise, we look forward to seeing you all at our next in-person quarterly meeting. Again, that will be on Tuesday, December 12th, and then we will also convene again as a work group on December 20th. But in the meantime, happy holidays to everyone. We are very, very thankful for you all. So do continue to take good care and let us know if there's anything we can do to support you in the meantime.
Bye, everyone. Thank you.
Be well, everyone.
Thank you.
Thank you. Bye-bye.